The career path that I chose to investigate was a trauma surgeon. Becoming a trauma surgeon has many skills that need to be perfected to be efficient on the job. The surgical critical care training involved with becoming this type of surgeon enables one to address injuries to the neck, chest, abdominal, and extremities. As a trauma surgeon, one must be familiar with many broad, general surgeries along the thoracic and abdominal cavities. Because they have to deal with patients on the spot and deciding life or death situations, the surgeon is responsible for prioritizing areas that need to be worked on and designing an overall treatment plan. The job starts in the emergency room and is usually moved to the operating room if it's a critical injury. This profession requires one to make complex decisions within a small amount of time and incomplete information. It involves long and irregular hours that can take up most nights, weekends, and holidays. The specific career that I want to pursue is called an acute care surgeon, which combines the practice of trauma surgery and emergency general surgery into one category. The first step to becoming a trauma surgeon is getting a bachelor's degree in pre-med biology or another related science. Next, a student has to pass the MCAT and complete 4 years of medical school, which involves lab work and 2 years of working in real healthcare environments. After med school, one can earn an MD by taking the United States medical licensing exam to be able to practice medicine. Students then spend 3 or more years in general surgery where they complete surgical rotations. After this, there are 3 more tests to complete, including the general surgery qualifying exam, followed by the general surgery certifying exam. And if both are passed, one can take the surgical critical care certifying exam and would be a board-certified trauma surgeon. When I interviewed Dr. Neil Sakwa, a surgeon at Neil Sakwa Plastic Surgery, I asked him questions about his career and what it entails. He became a surgeon to follow in the footsteps of his father, who was a general surgeon, and his brother, who was becoming a heart surgeon. When I asked him what a career as a surgeon involves, he said the number one thing would have to be time. He said the 4 years of college, 4 years of medical school, and 7 years of residency becomes a huge sacrifice in your life, and in the end you have a lot of student loans to pay off. Dr. Sakwa said the most interesting thing about being a surgeon is getting to help people be healthier. In his path as a plastic surgeon, he said making people prettier, skinnier, and happier is very rewarding work. The most challenging thing about being a surgeon, he said, was the pressure of surgery and making sure you don't worsen a patient's condition. Also making sure they were always happy is very stressful. To get where he is today, Dr. Sakwa said he worked extremely hard in school, and in the summer he would work in hospitals to get as much experience as possible. He said he would always try to be ahead of all his classmates because becoming a surgeon is a very competitive career path. His advice to anyone that is aspiring to be a surgeon would be to work hard, study, do above what you are told to do, and never lose focus. He said when he looks back at all that he has accomplished, he wouldn't change anything he had to do to become a surgeon. He said he's built such great relationships with such wonderful people, and he loves his job. What I found most interesting about this path is being right in the middle of all the action when a patient in critical care comes into the ER. I love to be the person to assess the situation and know exactly what actions to take to improve the patient's health. Overall, patient care is what draws me in the most. Being able to actually see results in someone's health based on my actions would give me the best feeling in the world. Also, being an acute care surgeon allows for me to travel the world and help developing nations improve their health care. The wide variety of jobs I can do with this career makes me interested in becoming one. The most difficult task I would have to face would be watching a patient's condition worsen or watching a patient die knowing I couldn't do anything to save him or her. This situation would most likely happen often and comes with the job. I hope I will be able to conquer that part of the job and still be a successful surgeon. I chose this path because I believe it will be a good fit for me based on what I find most interesting in school and outside of school. Also, I like taking care of people and discovering new things. There is an okay likelihood that I will pursue this career. Based on my research, the schooling is intensive and takes a fairly long time to complete all the requirements. I believe the benefits will outweigh the cost of staying in school for such a long time. Choosing this career path would make my life very rewarding.